Hi, I'm Laura Westfall. I'm a physician assistant at Mass General Emergency Department, and we are going to review this interesting case. We had a 23-year-old male who came in presenting with acute onset of shortness of breath and chest pain. These were his triage vitals. So he's slightly tachycardic, blood pressure slightly high for a young, healthy male. Respiratory rate was recorded at 16. But upon walking into the room, the patient looked to be very uncomfortable, very tachypnic, was tripoding, looked to be struggling a bit to breathe. So I grabbed the bedside ultrasound to take a look at his lungs. And this was the first clip in the right upper lung fields, and you can see that there is some lung sliding here. But you can also see that he is working pretty hard to breathe. You can see the chest wall is moving pretty significantly, and he is tachypnic. So now moving down the chest wall, we can actually see a lung point. On the left side here, you can see that there is some lung sliding, and on the right here, you can see there is no lung sliding. So this is a lung point that's suggestive of pneumothorax. So just to compare these, on the right, this is the clip we just looked at with the lung point. On the left here, this is a normal view of lung sliding where you can see the lung sliding throughout the entire clip here. And on the right, you can see on the right here that the lung does not appear to be sliding at all. So if you're not sure if you're seeing lung sliding, you can put it in M mode to look for motion. On the left, we see normal lung sliding here. In M mode, when you look for motion, you're going to see what looks like sand on a beach. On the right here, we actually didn't do it right at this point because you would get some motion above the lung point. But if you move down closer to this area where you see no lung sliding, and you look in M mode, you just see what looks like a barcode indicating that there's no motion. So this is going further down the chest wall, now looking in the right upper quadrant. So we have the liver here, you have the diaphragm. You can start to see some of the lung coming into view here. You can see that it's all anechoic here, that's suggestive of fluid. The bubbles here are suggestive more of hemothorax because it shows that there's some active extravasation happening. This tissue here is likely an adhesion that's attached to the diaphragm. This is just another image from the same view. So again, he was sitting up and was tripoding, so this is a slightly different angle. However, on the left we have a normal right upper quadrant where you can see the spine, the liver, the kidney, and the diaphragm is smooth, and you can see the lung coming all the way down to the diaphragm. There's no anechoic area. On the right, again, this is our clip where you can see fluid in the chest. You see this adhesion moving, and you see these bubbles indicating likely hemothorax. So this is looking at a lung point where you can see the lung on the left with no sliding, and we can actually see the fluid on the right, all in one clip here. So at this point, we get him on the monitor, and you can see that his vitals have changed significantly since he presented to triage. This was just 15 minutes after presentation. His heart rate was now 140. He was setting 88% on room air, and he was in extremis. He immediately had needle decompression done, had air coming out, and he was starting to feel a little bit better. A chest tube then was placed, and he had both air and blood that were evacuated. If you have any questions or comments, you can contact us at this email address. Let us know what you think.